Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Axillary surgery and breast cancer, primary results of the INSEMA trial. Background. Whether surgical axillary staging as part of breast-conserving therapy can be omitted without compromising survival has remained unclear. Conclusions. In this trial involving patients with clinically node-negative, T1 or T2 invasive breast cancer, 90% with clinical T1 cancer and 79% with pathological T1 cancer, omission of surgical axillary staging was non-inferior to sentinel lymph node biopsy after a median follow-up of 6 years. Antibiotic treatment for 7 versus 14 days in patients with bloodstream infections. Background. Bloodstream infections are associated with substantial morbidity and mortality. Early, appropriate antibiotic therapy is important, but the duration of treatment is uncertain. Conclusions. Among hospitalized patients with bloodstream infection, antibiotic treatment for 7 days was non-inferior to treatment for 14 days. Liberal or restrictive transfusion strategy in aneurysmal subarachnoid hemorrhage. Background. The effect of a liberal red cell transfusion strategy as compared with a restrictive strategy in patients during the critical care period after an aneurysmal subarachnoid hemorrhage is unclear. Conclusions. In patients with aneurysmal subarachnoid hemorrhage and anemia, a liberal transfusion strategy did not result in a lower risk of an unfavorable neurologic outcome at 12 months than a restrictive strategy. Next, we will be discussing articles from Journal of American Medical Association. Atezolizumab in high-risk locally advanced squamous cell carcinoma of the head and neck. A randomized clinical trial. Question. Does maintenance atezolizumab improve clinical outcomes in patients with locally advanced squamous cell carcinoma of the head and neck at high risk of disease progression after multimodal definitive treatment? Findings. In INVOKE-010, a randomized clinical trial with 406 patients, median investigator-assessed event-free survival was 59.5 months with atezolizumab versus 52.7 months with placebo, hazard ratio 0.94. No new safety signals were identified, meaning atezolizumab did not improve clinical outcomes in this patient population. Further work is required to identify new treatment options for these patients or better select who would benefit from this treatment. Adjuvant PD-1 blockade with Camrelizumab for nasopharyngeal carcinoma. The DIPPER randomized clinical trial. Question. Does adjuvant programmed cell death 1, PD-1, blockade with Camrelizumab improve survival in patients with locoregionally advanced nasopharyngeal carcinoma? Findings. In this randomized clinical trial involving 450 participants with locoregionally advanced nasopharyngeal carcinoma, those receiving adjuvant Camrelizumab had a 3-year event-free survival rate of 86.9% compared with 77.3% in the observation group, showing a significant difference, meaning adjuvant PD-1 blockade with Camrelizumab is a promising treatment strategy that significantly improve event-free survival in patients with locoregionally advanced nasopharyngeal carcinoma. Next, we will be discussing articles from British Medical Journal. Projections for prevalence of Parkinson's disease and its driving factors in 195 countries and territories to 2050. Objective to predict the global, regional, and national prevalence of Parkinson's disease by age, sex, year, and socio-demographic index to 2050, and quantify the factors driving changes in Parkinson's disease cases. Conclusions. By 2050, Parkinson's disease will have become a greater public health challenge for patients, their families, caregivers, communities, and society. The upward trend is expected to be more pronounced among countries with middle socio-demographic index, in the global burden of disease East Asia region, and among men. This projection could serve as an aid in promoting health research, informing policy decisions, and allocating resources. Next, we will be discussing articles from Lancet. Global, Regional, and National Prevalence of Adult Overweight and Obesity, 1990 to 2021, with forecasts to 2050, a forecasting study for the Global Burden of Disease Study 2021. Background: overweight and obesity is a global epidemic. Forecasting future trajectories of the epidemic is crucial for providing an evidence base for policy change. In this study, we examine the historical trends of the global, regional, and national prevalence of adult overweight and obesity from 1990 to 2021, and forecast the future trajectories to 2050 interpretation. No country to date has successfully curbed the rising rates of adult overweight and obesity. Without immediate and effective intervention, overweight and obesity will continue to increase globally, particularly in Asia and Africa, driven by growing populations. The number of individuals with overweight and obesity is forecast to rise substantially. These regions will face a considerable increase in obesity-related disease burden. Merely acknowledging obesity as a global health issue would be negligent on the part of global health and public health practitioners. More aggressive and targeted measures are required to address this crisis, as obesity is one of the foremost avertible risks to health now and in the future, and poses an unparalleled threat of premature disease and death at local, national, and global levels. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Hepatology: Frailty and Risk of Metabolic Dysfunction Associated Steatotic Liver Disease and Other Chronic Liver Diseases. Frailty, assessed by two complementary tools, was associated with an increased risk of incident chronic liver disease. Compared with physical frailty, the frailty index demonstrated a stronger association with the risk of incident MOSLD. The association between frailty and MOSLD risk remained qualitatively unchanged when MOSLD was defined as PDFF greater than 5%. This study warrants efforts to identify, manage, and prevent frailty to reduce the risk of chronic liver diseases. Non-invasive assessment of severe liver fibrosis in patients with Fontan-associated liver disease. The Valdig-Azil-Fonliver cohort. The prevalence of severe fibrosis in patients with Fontan-associated liver disease is high. Severe liver fibrosis is associated with a deterioration in circulatory and clinical status. Novel Fon liver risk score, combining liver stiffness and platelet count, is a valuable non-invasive tool for predicting severe fibrosis. Fon liver risk score can be easily integrated into routine assessments for patients with Fontan circulation. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Creeping fat-derived free fatty acids induce hyperplasia of intestinal muscularis propria muscle cells, a novel link between fat and intestinal stricture formation in Crohn's disease. Background and aims. In Crohn's disease, wrapping of mesenteric fat around the bowel wall, so-called creeping fat, is highly associated with strictures. The strongest contributor to luminal narrowing in strictures is a thickening of the human intestinal muscularis propria, MP. We investigated creeping fat-derived factors and their effect on mechanisms of human intestinal MP smooth muscle cell, HIMC, hyperplasia. Creeping fat-released long-chain FFAs induce a selective proliferative response by HIMC. These results point to creeping fat as a novel contributor to stricture formation in Crohn's disease. Here are the articles from Clinical Gastroenterology: Pre-injection with ligation-assisted endoscopic mucosal resection for Barrett's dysplasia and early esophageal adenocarcinoma. Characteristic histological features of the depth of resection. Background and aim. Endoscopic mucosal resection, EMR, is an established technique for the diagnosis and treatment of high-grade dysplasia, HGD, and early esophageal adenocarcinoma, EAC, in Barrett's esophagus. Submucosal pre-injection is not universally used or generally recommended when performing routine ligation-assisted EMR. Prior studies, however, have demonstrated evidence of at least superficial muscle injury on ligation-assisted EMR without submucosal injection. There are limited published data supporting any potential benefit of submucosal pre-injection. Our aim was to review this technique and determine the rate of any degree of muscle injury in patients with Barrett's HGD and EAC, treated with submucosal pre-injection before ligation-assisted EMR. Conclusions. Pre-injection before ligation-assisted EMR achieved complete excision with histologically clear margins, without histological evidence of any inadvertent muscularis propria. Next, we will be discussing articles in the field of rheumatology. Changes in long-term glucocorticoid use among older adults after new diagnosis of late-onset rheumatoid arthritis. Background. We evaluated changes in long-term glucocorticoid, GC, use and factors associated with persistent GC use in older adults with late-onset rheumatoid arthritis, LORA. Conclusion. Long-term GC use declined more among DMARD-exposed than DMARD-unexposed patients. 1 in 7 DMARD-exposed and 1 in 10 DMARD-unexposed have persistent GC use, which is associated with financial barriers and multimorbidity that may limit the use of steroid-sparing DMARDs. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Risk of malignancy related to exicizumab in patients with psoriatic arthritis or axial spondyloarthropathy, systematic review and meta-analysis. Background. We aimed to estimate the risk of malignancy associated with exicizumab in randomized controlled trials, RCTs, and long-term extension studies, LTEs, in patients with rheumatological indications. TOTS. Conclusion. Exicizumab appears to confer a low malignancy risk in patients treated for rheumatological indications. Patients with psoriatic arthritis and axial spondyloarthritis appeared to be at similar risk, except for those with non-melanoma skin cancer. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Long-term efficacy and safety of acoramidis in ATTR-CM. Initial report from the open-label extension of the Attribute-CM trial. What is new? This article extends the observations from the Attribute-CM trial, efficacy and safety of AG10 in subjects with transthyretin amyloid cardiomyopathy, of acoramidis in the treatment of transthyretin amyloid cardiomyopathy. Attribute-CM was designed with a fixed treatment duration of 30 months. The treatment effects on clinical outcomes, all-cause mortality and cardiovascular-related hospitalization, and other measures of morbidity, physical function, and quality of life are reported out to 42 months for participants continuously treated with acoramidis, compared with those previously receiving placebo, and initiating acoramidis in the open-label extension. What are the clinical implications? These long-term data support the positive efficacy and safety profile of acoramidis, because participants who received concomitant tafamidis in Attribute-CM were required to discontinue tafamidis to be eligible for the open-label extension. These data from the open-label extension can be interpreted without the potential confounder of concomitant tafamidis use. Observations from the open-label extension suggest that reductions in functional capacity and quality of life, observed in the placebo arm of Attribute-CM, do not recover if disease-modifying therapy is delayed. Most important, the treatment effects of continuous acoramidis on clinical outcomes underscore the importance of early diagnosis and initiation of disease-modifying therapy. Here are the articles from Journals of the American College of Cardiology. Predictors of outcomes of reintervention after transcatheter aortic valve replacement. Background. In a context of extending transcatheter aortic valve replacement, TAVR, to patients with a longer life expectancy, it is important to better document the incidence and outcomes of reintervention. Objectives. The authors sought to evaluate the incidence, predictive factors, and long-term outcomes of surgical, explant TAVR, or transcatheter, redo TAVR, Reintervention after TAVR. Conclusions. Reintervention after TAVR remains rare and was mostly performed early after the procedure and by redo TAVR. Further studies are warranted, particularly in younger patients with longer life expectancy. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Weight-specific grip strength as a novel indicator associated with cardiometabolic risk in children. The EMSUNG study. Context. Hand grip strength, HGS, is an important indicator of sarcopenia and adverse health outcomes. However, evaluating HGS in children presents challenges, and its association with metabolism remains incompletely understood. Objective. To establish grip strength reference values for Chinese children and adolescents, as well as to evaluate the relationship between HGS and cardiometabolic risk. Conclusion. This study established grip strength reference values for Chinese youth, introduced the concept of weight-specific HGS and RHGS, and demonstrated a dose-dependent relationship between weight-specific grip strength and cardiometabolic risk. These findings highlighted the association between low muscle strength and increased cardiometabolic risk. Here are the articles from Diabetes Care, the association between cost-related insulin rationing and healthcare utilization in U.S. adults with diabetes. Objective. To examine the association between insulin rationing and healthcare utilization. Conclusions. Insulin rationing was not associated with higher healthcare utilization, but concurrent rationing of healthcare may mask a relationship. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Impact of fluid balance on the development of lung injury. Rationale. The pathophysiological relationship among fluid administration, fluid balance, and mechanical ventilation in the development of lung injury is unclear. Objectives. To quantify the relative contributions of mechanical power and fluid balance in the development of lung injury. Conclusions. Our study did not detect a significant difference in lung injury between high and low mechanical power. Some damage is directly attributable to mechanical power, while additional injury appears to result indirectly from high fluid balance, which reduces end expiratory lung gas volume, with ascites playing an important role in this process. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Perspectives and Experiences of Patients with A.I.O, a systematic review. 6 themes have been identified reflecting the perspectives and experiences of adults with A.I.O. Patients are unaware of A.I.O diagnosis and prognosis, feel that care is fragmented, and are burdened by treatment. Providing education, reducing treatment burden, and ensuring excellence in care may help to address patients' needs and improve A.I.O management. Here are the articles from Kidney International Reports. Randomized trial of pegmalesetide for the treatment of anemia in patients with non-dialysis CKD. Introduction. Pegmalesetide has been recently approved for treating anemia in chronic kidney disease, CKD, patients in China. We presented the results of the pivotal study conducted in patients with non-dialysis dependent, NDD CKD with anemia. Conclusion. Pegmalesetide demonstrated comparable efficacy to epitin alpha in elevating and maintaining HB levels in patients with NDD CKD with anemia without new safety concerns. The next article from Kidney International Reports. Influence of individual and area-level social determinants of health on likelihood of living versus deceased donor kidney transplantation. Introduction. Social determinants of health, SDOH, are associated with disparities in access to living donor kidney transplantation, LDKT. However, the separate and joint impact of individual and area-level STO on the likelihood of LDKT versus deceased donor kidney transplantation, DDKT, is unclear. Our findings suggest that individual and area-level STO play overlapping but distinct roles contributing to disparities in LDKT. Addressing individual and area-level STO is crucial. considering the accentuated effect of income at the individual rather than area level.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.